For many of the hormone supplementation monitoring scenarios, there are a lot of complications and caveats that we have to consider. In this particular video, we're talking about hormone patches, pellets, and injections, and these are a lot easier to monitor. When you're taking hormones by these methods, you get more of a systemic increase in hormone levels that is pretty steady, and so it makes it a lot easier to monitor. So if you look at, for example, a patch, when you take an estrogen patch, this is entirely different than when you take a transdermal cream or gel. The delivery method gives you a steady increase. If you look at serum data, you get a linear dose-dependent increase. We see the same thing in urine testing, and to some degree you can see that in saliva as well. But what we also see is between the doses of those two patches, you get a nice plateau. So essentially you get a nice steady target to shoot at in terms of getting a good number, whether it's in blood or it's in urine or in saliva. In saliva, when you're looking at an estrogen patch, the biggest downside is simply that it's harder to measure. So you go back to some of the arguments of just which test is better, generally speaking, to monitor estrogen. But the level of estrogen in your blood, in your saliva, and in your urine should be a pretty good approximation of what's going on systemically. So then obviously, if you're looking for added value, that's where urine testing really excels. If you look at this particular patient here, here's a woman who I happen to know personally who hates her estrogen patch because she doesn't feel well on it and has some symptoms associated with estrogen dominance when she's on the patch. When we look at her levels when she's on the patch, and this is pretty atypical, she is really, really high for the amount of estrogen that she's exposed to from the patch for some reason. So for her, this is effective clinical information, and her choices are obviously either to scale back the dose of her patch or maybe choose a different route of administration. When we look at her symptomatically, we get a nice correlation between the symptoms and what's going on with her hormone levels. And then of course, because it's a urine test, we can go further and explore phase 1 metabolism, 2-hydroxylation, 4-hydroxylation, 16-hydroxylation, as well as the methylation, which is a part of phase 2. So we get a nice representation of a lot of time throughout the day, and that's an advantage of urine testing. However, with a patch, serum testing should work pretty well too because it's a nice steady level of hormones throughout the day. Again, the urine testing is going to then add the value of the metabolites. Now, when you're looking at an injection and you look over several days, if you look at this data here, you can see, yes, those levels are dropping, but within a day or at a particular time, you should get reasonably effective monitoring by looking at a serum value, by looking at a urine value or a salivary value. The added value to the urine test is, again, looking at metabolism. If we're looking at estrogen, we've talked about those metabolites, but if it's testosterone, we can also look at how much DHT is being made from that testosterone, which is also an effective way to monitor therapies, not just to look at the parent hormone, but also to look at the metabolites. So what you want to be careful with here is less which test you use and more of what time point you do the test. So we get people periodically who will get a testosterone injection and test right after it, and they typically get very high values. That might be good to know, but it's probably not the best time to test. So it really depends on what question you're trying to ask. If you want to know, hey, what are the peak values after my testosterone injection, then test the next day. If you want to know what the lowest level you're getting to before the test is, then you'll want to test right before an injection. What we usually coach people to do is to test halfway in between, and that gives you the best look at kind of your overall value for the hormone levels with respect to the supplementation. With pellets, obviously, the pellets are going to go in and stay in typically for months. So it's good to monitor hormones, and I think especially the metabolites to make sure it's being metabolized effectively, because you're not going to undo a pellet overnight. You're going to have that hormone in you for quite some time. So again, you can test anywhere in between. With a pellet, it's going to be a slow, steady release. Probably want to give it a week or two after you put the pellet in, but then you can pretty much test any time there in between and get a good, effective look at the hormone levels in blood or in urine. Salivary testing may work well for pellets. I haven't seen a lot of data on that. There may be some concern that when you take transdermal hormones, you get these spurious, really high results in saliva. And if you've got your hormone next to the skin, there may be some anomalies there in terms of the lab value. I haven't seen a lot of those numbers, so I'm not entirely sure. But conceptually, with a pellet, again, you should be able to use either blood or urine testing or saliva testing. And if you want more information on more challenging routes of administration to monitor, then you can look at some of the other videos in this series.